Good afternoon, everyone, and thank you for being here for our PICS annual forum. Before we begin, I would like to acknowledge the traditional owners of the land on which we meet today, the Wurundjeri Woi-wurrung peoples, and pay my respects to their elders, past, present, and emerging. Today we are celebrating an important milestone for paediatric cancer, the launch of the Victorian Childhood Cancer Outcomes Registry. This marks a significant step forward in how we understand, measure, and ultimately improve the outcomes and experiences of children and adolescents treated for cancer in Victoria. This registry is more than a data project. It is a commitment to every child and family and every clinician who walks the childhood cancer journey. With that in mind, it is my pleasure to hand over to Professor Brendan Murphy for the Children's Cancer CoLab for an important announcement that will help secure the future of this work and strengthen childhood cancer across Victoria.
Thank you very much, Justine. It's wonderful to be here on behalf of the Children's Cancer CoLab, and I'll introduce our special guest, the Minister, shortly, but I would like to acknowledge also a number of incredibly important, influential people here, but I would like to acknowledge also Peter Mac Board Chair, Professor Rosemary McKenzie, Jason Payne, the CEO of Peter Mac, an old colleague of mine, Professor Michelle Telfer representing the CEO of the Children's, and my fellow board members David Heath and Michelle Yong, and obviously our colleagues from the Children's Cancer Foundation, Sally Armstrong, who we'll hear from later, and Nari Elwood. But it is a really wonderful moment for us from the Children's Cancer CoLab to be here to share this exciting news with PICS. Children's Cancer CoLab, for those who haven't been exposed to Udani's impressive presentations till now, was formed from the vision of the Children's Cancer Foundation and the Victorian Government, a vision that children's cancer needed a fundamentally different approach. No single hospital, funder or research team can solve this problem alone. We must all work together. Children's Cancer CoLab is an independent, not-for-profit organisation uniting government, philanthropy, researchers, clinicians, survivors and families under one mission: to accelerate breakthroughs to create a future where every child with cancer can survive and thrive. Children's Cancer CoLab invests in research and infrastructure projects with the potential for the greatest impact. VCCOR is exactly that kind of investment, the Children's Cancer Outcomes Registry. It is Victoria's first statewide registry connecting diagnosis, treatment and long-term outcomes for children and young people aged 0 to 25. We often forget that with 80% of survivors of children's cancer have significant long-term impacts. This registry is therefore crucial to follow the course of people who are fortunately cured of their cancer but have devastating lifelong effects following their cure. The Victorian Government's support for this work is genuinely transformative, and we're deeply grateful that the commitment to improving outcomes for childhood cancer patients and survivors is represented in this work. So it's now my very great pleasure to introduce our Minister, the Honourable Danny Pearson, Minister for Economic Growth and Jobs, who is championing this investment in childhood cancer and research and innovation, to make the formal announcement. Minister.
Well, thank you, Brendan, for that very warm welcome, and I too would like to acknowledge that we're meeting on Wurundjeri country, and I pay my respects to Elders past and present. The Victorian Government is committed to truth, treaty and self-determination for First Peoples, and Victoria is leading the nation with the truth-telling and treaty processes that are underway as the Yuruk Justice Commission helps us understand our history from the perspective of First Peoples, how it impacts on the present, and how treaty can be a pathway to practical changes and solutions. I'd also like to acknowledge Mayor and Dr. Sheila Patel and thank them for sharing their story, which has been an invaluable contribution. To Justine Carter and Dr. Kunika Bhatia from the Victorian Paediatric Integrated Cancer Service, the Chair and Chief Executive Officer of Children's Cancer CoLab, Professor Brendan Murphy, and Dr. Udani Reitz, as well as Board Directors David Heath and Associate Professor Michelle Yong. The Chief Executive Officer of Children's Cancer Foundation, Sally Armstrong, as well as CCF Board Director Associate Professor Nari Elwood, the Chair and Chief Executive Officer of the Peter MacCallum Cancer Centre, Professor Rosemary McKenzie and Professor Jason Payne, Professor Sue Evans, the Head of the Victorian Cancer Registry Division at the Cancer Council of Victoria, Dr. Michelle Martin, Head of the Children's Centre at Monash Health, and Chief Executive of Australia New Zealand Children's Haematology Oncology Group, Robin Strong, and finally the Chief of Medicine, RCH Associate Professor Michelle Telfer. Look, good afternoon. It's a pleasure to be able to join you at the Victorian Paediatric Integrated Cancer Services Annual Forum to announce the Victorian Government's support for the Victorian Childhood Cancer Outcomes Registry, an initiative that will benefit young cancer patients and their families across the state. Any parent can understand how devastating it would be to be told your child has been diagnosed with cancer. And every child who faces a cancer diagnosis is not just a patient. They are a cherished family member, a schoolmate, or a member of a local sports team. Thanks to the incredible work of our brilliant medical researchers, there have been incredible advancements in cancer treatment, and these have significantly improved survival rates. While completing their cancer treatment is a remarkable milestone, we know that is often just one part of a longer story. Many young patients, in fact up to 80%, face ongoing health, emotional and social challenges as a result of their diagnosis and treatment. The registry is just one of the ways Children's Cancer CoLab is working with and supporting our world-class universities, research institutes and health services to tackle that. And the registry does more than bring data together. By collating information about the journey of every single child diagnosed with cancer in Victoria, including their treatment and follow-up care, the registry will continue to help unlock new research to improve how childhood cancer is diagnosed and treated. It will also continue to drive evidence-based improvements in current care and services. Our support for the Children's Cancer CoLab is just one part of the Victorian Government's investments in medical research, in the medical research sector. And I'm proud to say that our state is a leader both nationally and globally in medical research. This is in part thanks to the $1.1 billion we've invested into medical research in Victoria over the last decade, establishing our state as a global leader and driving truly incredible breakthroughs in treatments and care. By investing across the full spectrum of medical research, from early career grants to global centres working to prevent the next pandemic, Victoria is building a state-of-the-art sector powered by some of the brightest minds in the world to advance life-changing breakthroughs in treatment and care. In closing, I'd like to reflect on the vision of Children's Cancer CoLab. Every child with cancer will survive and thrive. And I know everyone here today shares the vision of the Children's Cancer CoLab. Every child with cancer will survive and thrive, and for a future where more children diagnosed with cancer can grow up healthy and cancer-free. I do want to congratulate the Victorian Paediatric Integrated Cancer Service, the Children's Cancer CoLab, and the other partners for your work on developing the Victorian Children's Cancer Outcomes Registry. Thank you so much.
Thanks very much, Minister. And now I'd like to introduce a strong partner and colleague of Children's Cancer CoLab, the Acting CEO of the Children's Cancer Foundation, Sally Armstrong, to talk and address to the alignment between that foundation and this work.
Thank you, Brendan. The Children's Cancer Foundation was established in 1992 by visionary parents who wanted better support for their families. In the last 30 years, our foundation has raised more than $74 million for children and families impacted by cancer. The Children's Cancer Foundation gives voice to families and donors who fundraise with the hope that the next child diagnosed has a better journey than the one that they lived. Our community understands that treatment ending is not the same as cancer ending. the late effects, the unanswered questions, the ongoing care needs that follow families for years. Alongside the Victorian Government, the Children's Cancer Foundation is a major partner of CoLab. Together, we make it possible for CoLab to fund the critical research and infrastructure projects like VCCOR that no single organisation could deliver alone. Our foundation was a founding force behind CoLab because we believed philanthropic dollars go further when government, philanthropy and the sector pool their resources and work collaboratively. Our $10 million commitment to CoLab was made on that belief, and today is exactly the kind of moment that proves it. CoLab is delivering on our vision for a collaborative paediatric oncology ecosystem. Projects like the Outcome Registry is exactly what our donors fundraise for. They fundraise so every Victorian who has faced cancer can receive better, more coordinated and equitable care. On behalf of every donor, family and survivor in the Children's Cancer Foundation community, thank you to the Victorian Government, to CoLab, to the PICS team and to everyone in this room committed to ensuring that every child with cancer can survive and thrive.
Thank you, Sally. And if any of you haven't been to a $1 Million Lunch, it's an exemplar in fundraising. I've never seen anything more effective in all of my years in public health. A great organisation. So now I'd like to reintroduce Justine Carter, who's going to tell us a bit more about the Victorian Children's Cancer Outcomes Registry, which is the subject of this funding by Children's Cancer CoLab. So Justine.
Excellent. Thank you. Me again. We sincerely appreciate this grant, so thank you Minister Pearson, Professor Murphy and Sally Armstrong, and thank you to the Children's Cancer CoLab and Children's Cancer Foundation. Your support will enable us to fully embed the registry over the next 2 years. The registry brings together patient information that has until now been difficult to access at scale. By linking and analysing this data, we can gain a clearer picture of what is working well, where inequalities exist, and where we must focus our efforts to drive meaningful change. Over the past 40 years, survival for many childhood cancers has improved dramatically. That progress is a testament to research, clinical excellence, and the resilience of families. But we also know that survival is not the end of the story. Too many children still face cancers we do not fully understand, and for those who do survive, the impacts of treatment can be lifelong, affecting physical health, mental well-being, education, and overall quality of life. The Victorian Childhood Cancer Outcomes Registry will guide service improvement so that care is not only effective but more equitable and family-centred, and it will help us move closer to a future where children reach survivorship and where survivorship means living well. This launch represents collaboration, vision and a shared belief that every child deserves the best chance at a healthy future. So thank you to all of the clinicians, researchers, families and strategic partners who've contributed to bringing this registry to life. Your work will shape the outcomes for generations to come. Now we will hear from a number of presenter perspectives, each reflecting on the importance of a registry through the lens of Maya's story. Now 16, Maya was diagnosed with stage 4 high-risk neuroblastoma at age 3, a rare and aggressive cancer that develops from immature nerve cells. I'd like to introduce Maya and Sheila, Maya's mum, but first we will hear from a younger version of Maya and her perspectives at the time.
One for the caterpillar is belly shape. Ow, 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 my tummy hurt. Two wiggled and wiggled. He felt a funny tongue.
I don't know how to recover from that. Anyway, hello everyone. Lovely to be here speaking to you all today. I feel that it's interesting how there can be many misinterpretations of having cancer. One major one being that when you finish your cancer treatment, you finish it. It's done, and everything is all over. Well, I guess for myself, I had to find out the hard way that no, not everything is automatically going to be over. Instead, I'm going to have to live my life intertwined with complication after complication that will constantly impact my day-to-day life. The real difference with being a kid and now being the current age that I am when it comes to facing different health complications related to my cancer treatment was that I found funny ways to deal with them, as you saw in the video, and cope with issues that were coming my way. I learnt to embrace my surgical scars, make jokes about my height and difference in size with classmates, and manage my cancer-related stomach complication to the best of my ability. But when I eventually became a teenager, I started to feel sadder about things. Being told that I couldn't produce children of my own when I was around the age of 10 did affect me, but not to the full extent. As I got older and began to have health classes on normal teenage development, it became quite exhausting learning that I would never develop normally like the other girls in my year level, be a normal height, have perfect skin with no harsh scars on it, and that my body was incapable of doing the main function that a woman's body was supposed to be able to do. When I was in grade 4, I had a crazy episode whilst at a school camp, where my stomach problems flared up and left me unable to participate in any activities, and I had to be driven by ambulance to the Royal Children's Hospital the day before the camp ended. This seemed like a manageable situation at the time because I hadn't been sick before the camp, and having stomach pain was a very normal occurrence for me, which I treated with heat packs, basic over-the-counter medication, fasting myself off normal meal times, and rest at home. There were rare occasions that I did have to go into hospital if I wasn't able to eat or drink fluids for more than 2 days, to undergo intravenous fluid. Whilst my stomach pain episodes that I had were stubbornly painful and barely relieved by the basic paracetamol, I lived my life pretty much like a normal child, always giving everything a go with the fear of missing out. But as I got older, I began to be put in the position where I had to make very important life or death decisions regarding how I managed my chronic illness. In Year 9 at my school, the curriculum dedicates 1 term of school where a group of Year 9s get to go up to the border of New South Wales and Victoria and stay in a remote camp, cooking, cleaning and looking after themselves for a whole term. This was the opportunity of a lifetime, the ultimate bonding time away from siblings and parents, a place where young girls went off and came back women. Being a camp enthusiast, I was so excited to get away from my parents, but at the same time, I was undeniably stuck. Whilst all the other girls got to talk about cabin placements and what they were going to pack, I felt scared as I looked down at my central line in my chest and realized I'm probably not going to be able to go to this camp. Do I risk it? Do I pack supplies, line train my teachers, line train myself, and maybe face having a septic shower, being stuck in the middle of nowhere, no hospital in sight? Or do I take the safest option and not go? While this camp didn't shape my whole teenagehood, having to have a central line inserted after a painful stomach flare was difficult and not something that I wanted to be stuck with. Sure, I'd had central lines in the past through my cancer treatment, it was no stranger, but now having it as a teenager, I faced so many new challenges. I wanted to wear cute tops, show off my shoulders, spaghetti strap dresses, but having a central line in suddenly made me feel very self-conscious about what I looked like and about what people would think about me. Every day I was so scared that if I did something wrong or moved a certain way, my dressing would peel off and I'd get a line infection, or I'd get an infection somehow, and would have to miss another few months off school that I was already behind in because of all the sick days I was having to take off for my stomach problems. The challenges I faced with hearing impairment as a result of chemotherapy also began to affect me more as I realized that with being older, it's not necessarily socially acceptable to not join in on a conversation or respond back to someone just because I can't hear them. I had people start to shame me, make me feel bad that I wasn't participating in conversations, even though I had absolutely no idea what was being said in the first place, as sometimes lip reading was too hard and The background noise was too loud. They could have been speaking a whole other language for all I knew. As a teenager, I began to experience listening fatigue from always having to work my ears harder and started to feel stressed and overwhelmed. I'm only 16, and I'm still learning more and more about myself and my conditions every day. With aging comes experience, and I've learnt how to manage my conditions in my day-to-day life with hospital support, of course. I think it's important to remember, like I said at the start, that having cancer is one thing, but there are things that can occur after it that are just as hard a journey to navigate. Thank you.
Thank you, everyone. I'm honoured to share what childhood cancer survivorship means as a parent. Maya has described already its personal impact at such a young age. At the time of diagnosis and treatment, we of course focused on a cure. We held on to the treatment protocols and hope, but what we've learned in the years since is that cancer did not equate to restored health. For children, survivorship becomes a lifelong road, determined by acquired disabilities, chronic health conditions, hospital admissions, ongoing medical surveillance, and social adjustments that evolve with each stage of development. You've already heard about some of the challenges Maya's faced and how they've affected her. From a parent's perspective, it has been an enormous learning curve, navigating medical systems, coordinating care across specialities, understanding and supporting her emotional needs, and constantly advocating to ensure that school environments are appropriately structured to meet her learning needs. For a parent, survivorship means vigilance and living with a degree of uncertainty about what complications may emerge next. This is why the Victorian Childhood Cancer Outcomes Registry matters. The registry will enable long-term monitoring of treatment-specific and cancer-specific health effects. It allows us to quantify treatment harms and observe patterns of late effects by cancer type and therapy. It supports early risk identification and intervention, and it will provide the evidence required to improve treatment protocols and guide survivorship care models. Most importantly, it ensures long-term health and quality of life are tracked, valued, and improved. Behind every data point is a child similar to Maya, growing up, making decisions about their future, managing friendships and independence while carrying that lifelong legacy of treatment. As parents, we not just want survival, but the healthiest, fullest life for our children. Thank you.
Well, I'd now like to hand over to some very special people, Dr. Marty Campbell and Dr. Michael Nightingale, who treated my cancer and cared for me throughout my complications. I might not remember everything from when I was 3, but I am deeply grateful for the care they gave me.
Thank you. Surgery always goes first. So. Almost 13 years ago, I had my hands in the scrub sink getting ready to operate on a little 3-year-old girl called Maya. I was going to try to help save her life, but I also knew that I was about to change it forever. Maya's neuroblastoma had grown from her adrenal gland, had crept towards her spine, had wrapped itself around the major blood vessels that fed all of the vital abdominal organs. At that time, there were things that I knew, and there were many things that I did not know. I knew that for Maya to have the best chance of surviving, I had to remove every little piece of tumour I possibly could. What I didn't know, and what no surgeon can ever fully know, is the cost of what I was about to do. Not just immediately after surgery, but for Maya the child, Maya the teenager, Maya the adult, and Maya the retiree, the pensioner. Complications and outcomes from surgery are deeply personal to surgeons. We can't blame them on the protocol, we can't blame them on the chemotherapy, we can't blame them on the radiation. The scalpel is in our hand and we decide how to use it and where to use it. And so we're directly connected to the results. And that connection is lifelong to everything that follows, which is joy but also regret. Oncology surgery is not one decision, it's 100 small decisions, and each one building on the last. What incision do I use? Do I use a vertical incision that preserves muscle and nerve but limits my access? Do I do a transverse incision that gives better exposure but cuts the muscles of the abdominal wall? What will that mean for her at school? Playing sport when she is 20. What does it mean when she's 60 trying to get out of a chair? I have to move her bowel out of the way to access the tumour. How do I handle it to protect it from scarring and adhesions? Do I try to preserve the blood supply to her ovary? What does that mean for puberty? What does it mean for her fertility? What does it mean for her menopause? The tumours wrapped around the great vessels at the back of her abdomen, the ones that keep every organ inside alive. How far do I go? Is the risk of damaging them really worth it? The tumour was stuck on the deep muscles of her back. How do I get it off? Do I disrupt those muscles and nerves, altering the growth of her spine? What am I going to do to her posture? Will she have back pain for the rest of her life? And finally, I have to resect the lymph nodes, damaging the nerves that control her gut. What am I going to do to her digestion, to her growth and nutrition? Will I affect her height? Every one of those questions needed to be answered, and I wasn't sure my answers were right. So when I closed that wound, I'd done my best to save her life, but I did not know, and I could not know, what I'd set in motion for the life ahead of her. And so that's exactly why I'm here today. Maya's challenges didn't end in the operating theatre that day. There are consequences of treatment, necessary life-saving treatment, but lifelong consequences nonetheless. The trust that parents place in us when they bring their child to the operating theatre is the greatest privilege that a surgeon can have. But privilege has an obligation to continually improve, and to improve we must learn. And the VCOR database will be vital to surgeons like me. It means that decisions will be informed by real longitudinal evidence about what happens to children. It means we can refine our surgical decisions to get the best outcomes. We can improve our counselling of families. We can be better at anticipating problems before they become a crisis. And it means that every journey becomes part of something that helps the next generation. My sincere thanks to all the funders, developers, and all of the people who have worked on this project. Thank you all, and thank you especially, Maya, for the privilege of being your surgeon.
First of all, I want to thank you, Sheila, for giving us your parental perspective. And of course, Maya, thank you so much for sharing your experience of your cancer journey and reminding us that it doesn't finish with the last course of chemo. It's been many years since you completed therapy, and I must admit I'd actually forgotten some of the many complications that you had suffered as a result of the intensive therapy needed to cure your disease. I know that, at least in part, this is due to your amazing attitude of dealing with adversity and always having a smile on your face. After Maya was diagnosed with high-risk neuroblastoma, she was enrolled in a clinical trial of an immunotherapy known as dinutuximab, a therapy which has now become standard of care. She did, however, suffer some severe toxicity from this therapy, a toxicity that she clearly still lives with today. Clinical trials gives us very valuable data on outcomes and toxicity within a controlled environment, but for individual patients, real-life data is actually more important. Clinical trials are not always available for our patients, and many do not meet eligibility criteria, even if the study is open. But for all children treated outside clinical trials, their data is equally important. Local practice varies from institution to institution, and this is not reflected either in large clinical trial data. As an example, we now use dinutuximab routinely for high-risk neuroblastoma outside of clinical trials. It can be delivered in the outpatient setting as well as an inpatient setting, but toxicities can vary significantly. Dinutuximab is now also used for relapse and refractory neuroblastoma, so it will be of great benefit to us as clinicians to review our local toxicity and outcome data to help guide how best to deliver this therapy to minimise toxicity while maintaining positive outcomes. As I stated earlier, I'd forgotten a few of the complications Maya endured during her treatment, but because of VCOR, I don't rely on my memory anymore, and we can actually get the data. We have a wonderful electronic medical record at RCH and the Parkville precinct, but data extraction actually is very complex, difficult and time-consuming, which limits our ability to review our practice to improve local outcomes, especially as we're busy clinicians. And this is where VCOR can make a massive difference. VCOR accesses and collects information from Epic, our EMR, as well as multiple different platforms, so we can get information about all the patients treated in Victoria, not just one site. Maya received her treatment before the introduction of the EMR and RCH, so also being able to access data prior to that would be extremely helpful. Now I'd like to hand over to Heather and Susan, who will be speaking more about VCOR within the context of the long-term follow-up program.
We are part of the clinical nurse consultant team in the PICS long-term follow-up program. Our role is to support children and adolescents after they complete their treatment for cancer and to monitor the potential late effects that can emerge months, years, or even decades later. However, our work is also part of a much bigger picture. Childhood cancer care spans diagnosis, treatment, surveillance, long-term follow-up, and for some families, end-of-life care and bereavement. Every part of that journey is connected, and every part benefits from comprehensive data. We first met Maya in 2017 when she was 7 years old, after she had completed her complex and lengthy treatment for neuroblastoma. Like many children finishing treatment, Maya was stepping into a new phase of life. Back at school, reconnecting with friends and family. But Maya was also entering a lifelong relationship with follow-up care, complex health issues, and a future that she and her family had not imagined for her. The treatments that saves lives can also leave lasting impacts. And for Maya, as we have heard, these impacts significantly affect her day-to-day life. I'm sure we can all agree that she navigates these challenges with a maturity and bravery well beyond her years. Thank you for sharing your experience with us today. Clinically, the program's role is to monitor, recognise and address issues early, to educate children and families to understand their own risks and to provide effective health promotion strategies to support them as they navigate life after treatment. Stories like Maya demonstrate why the Victorian Childhood Cancer Outcomes Registry is so important. For clinicians like us, having access to high quality linked data across the entire cancer journey is transformative. It allows us to track outcomes not just for individual children, but across large cohorts. We can see which late effects are occurring frequently, how various treatments impact long-term health and well-being, and proactively identify emerging concerns. Until now, this collection of information has been fragmented. The registry changes this. As childhood cancer survivor rates are improving, so should the collection of data. VCOR does just that, providing a statewide long-term view of child cancer outcomes.
The registry will also support research into late effects, an area where there is still so much to learn. For example, oncology treatments now include targeted therapies, and as personalised medicine continues to evolve, we need to understand any potential long-term consequences. The registry enables researchers to analyse large data sets, identify patterns, and ask complex questions to improve patient outcomes. This is not just about clinical outcomes, it's also about the patient experience. The data enables better understanding to address potential late effects, which can include cardiac and respiratory dysfunction, endocrinopathies, infertility, fatigue, neurocognitive difficulties, radiation-related sequelae, mental health concerns, or the social and emotional impacts of life after cancer. The registry will collect data to identify trends, and associated research will inform long-term follow-up guidelines, introduce new screening practices, and will enable clinicians to translate raw data into timely interventions and targeted education for children and their families. Importantly, the registry supports the entire paediatric cancer system. It helps clinicians caring for the newly diagnosed child to survivorship. It helps programs like ours, and it enables researchers and policymakers to plan for the future. For young people like Maya, this means a future where survivorship is not only about living longer, but living well. For families facing treatment today, it means a system that improves patient in real time. And for every cancer survivor and their families, it's knowing that data from their experience will help pave the way for a brighter future for children to come. And for those who have lost a child, it means their child's experience continues to shape better outcomes for others. We are proud to walk alongside children and families as they grow, and we are proud to see Victoria investing in a registry that will strengthen this work that we do for many years to come. Thank you.
Thank you. So what we've heard today reminds us that high quality linked data is essential not only for understanding outcomes, but for improving care at every stage. From diagnosis and treatment through survivorship, and for the families who carry the impacts of childhood cancer throughout their lives. VCOR will strengthen our ability to identify emerging issues, understand patterns across large cohorts, and ensure that every child's experience contributes to better care for the next. Today's launch is an important milestone, but it's also a beginning. To realise the full potential of this registry, we must ensure it has the support and investment to grow and evolve and deliver impact over the long term. As we close today, I would like to add a special acknowledgement and huge thank you to PICS Deputy Manager Belinda Zambello, without whose expertise and vision VCOR would not exist and this event would not have happened. So thank you. And finally, I'd like to ask you all to join me in thanking our presenters today. Thank you to Marty, Michael, Susan and Heather for sharing your insights and illustrating so clearly why a registry like this matters. And our very special thanks to Maya and Sheila for sharing your stories so beautifully. Thank you. Thank you.
She will.